Let me know once you're able to see my screen.
Okay, yes.
Okay, right. So when it comes to healthcare, right, we will try to you know understand from basics. So you see, the healthcare industry itself, it's a mix of all the establishments that are who are dedicated to prevention, promotion, or giving this diagnosis, treatment, and rehabilitation of medical conditions. These are the things that comprises the healthcare industry. And these treatments may be through by providing products or services, and me, and maybe by providing be it public wise or private wise also, right? And these services is delivered by definitely licensed practitioners in be it medicine, be it dentistry, be it pharmacists, nurses, allied health, and other providers with the sole objective of improving the quality of healthcare in the country, right? So be it any country, be it US or any other country, the objective will be the same. And main intention is to improve the lives of millions of people. In this case, I'm talking about America, right? Where that's the whole intention. So what makes what makes the demand? The primary demand drivers includes the population growth rate, increasing life expectancy, age in developed countries. What do you mean by life expectancy? The life expectancy is nothing but the average age that the person will live, right? So increasing life expectancy, age in development in the developed countries, advances in medical care, technology, pharmaceuticals, and medical breakthroughs, right? So these are the few primary drivers for demand, and there are a couple of profitability drivers also. Profitability drivers will include obtaining grants and federal funds, like effectively managing the patient demand and referring patients to the most cost-effective providers. It is a few profitability drivers. Okay, there's a brief introduction about the healthcare industry. That's there. What are the things that we'll be looking into? Okay, anything? Any questions here? Since you are in healthcare industry, you can add also.
Yeah, but no questions yet.
Okay. Now, who are the key players in the healthcare sector? The key players in healthcare sector will include healthcare providers like primary care physicians, hospitalists, nurses or hospitals, urgent care facilities. These are the few people who come under healthcare providers who are a key players. Next is the health insurance providers, right? So big organizations, big companies itself like United Healthcare, Kaiser Permanent, Blue Cross Shield, UMR, Athena, all these are giant health insurance providers, right? And then state and local governments through the state legislatures, health department, state medical boards, state insurance commission, and things, right? So these are few state and local governments. Federal government through their various regulatory agencies, which includes the U.S. Department of Health and Human Services, Food and Drug Administration, the FDA. Nowadays, it was there a lot of news. Center for Disease Control (CDC), Center for Medical and Medicaid Services, right? Center for Medicare and Medicaid Services (CMS). So these are all the federal government bodies or regulatory agencies that are involved actively, who are called as the key players in healthcare sector. Apart from this, we have suppliers. Suppliers also play a very integral part of the healthcare system. Who help in providing healthcare products. And what are these healthcare products? They include pharmaceutical companies, medical equipment companies, and other vendors providing health related products. So these are the suppliers. And then we have patients and healthcare subscribers also. We have patients and healthcare subscribers also who play a major role here. So these are the key players in healthcare sector. Do you think of anybody else apart from this?
Um, and also the caregivers, like you know how like in the
Like
um
daycare
what
takers?
yeah
Yeah,
caretakers,
yeah.
because there are some here they call as a hospice. So
Mhm,
where the senior, older or elderly patients,
mhm,
they
mhm,
stay in there, and
mhm,
there are some caregivers.
mhm,
They are similar to nurses, but they
mhm,
don't have the access to give the they don't have the authority to
mhm,
give the directions of like prescriptions.
mhm,
So, but they work under the actual nurses.
mhm.
So yeah, they those are like a caretakers or caregiver. It comes under
Understood.
hospice. Yeah.
Understood. Understood. Sure. Yeah. Yeah. Definitely. I think even they fall under this category. Absolutely. Sure. Okay. Great. So, anything else you want to add here?
No, that's all.
Okay. Sure. Next is on health services claim processes. So there are several steps involved in terms of claim process, right? Which is very important. The first step is the patient itself, with or without a healthcare insurance, they usually visit an in-network healthcare provider, or be it any hospital for any kind of medical services or for any of their health conditions. So the patients go to a in-network healthcare provider for any of the services, and there the healthcare provider renders healthcare related services, meaning the healthcare provider provides the healthcare related services to the patient and follow up with the care that is being provided. Now, after that, as part of the steps, the healthcare provider submits a claim. Healthcare provider submits a claim based on the treatments that were rendered to the patient, based on the treatments that were provided to the patient, right? Now, uh, so the based on the treatments rendered to the patient, health insurance provider or bill statement to out-of-pocket patient. So for out-of-pocket patients, there would be a bill statement that would be provided. Okay. Now, and the fourth step is the health insurance provider processes the claim. The insurance provider, they process the claim. And if the member has a financial responsibility, the member will receive an EOB. That is explanation of benefits, saying what kind of breakup plan, right? So EOBs will be provided, detailing what the health insurance provider has paid, and the healthcare provider will then send a bill to the member. If the balance, in case if there is any balance, that needs to be paid. So these are the steps kind of involved in healthcare service claims process, right? So any questions here?
No questions.
Okay, sure. Next is let's try to understand what's Medicare. So Medicare is a federal health insurance program in United States, which began in 1966 under SSA, and now mostly administered by the CMS, right? So basically, this provides health insurance for all the Americans who with these conditions, people who are 65 or older, or certain younger people with disabilities, and people with end stage renal diseases. Like, yeah, what is this end stage renal disease? It's about permanent kidney failure requiring dialysis or transplant, sometimes called as ESRD, that is end stage renal disease, and amyotrophic lateral sclerosis, so ALS, and Lou Gehrig disease. So for these things, there is a specific, specific Medicare provided, but otherwise the general conditions are people who are 65 or older, or certain younger people with disabilities. For them, this federal health insurance program called Medicare is provided by the United States. Okay. Any questions here?
No questions.
And who qualifies for Medicare? So as I told in the previous slide, it's same thing. We are entitled for Medicare if we are at least 65 years and must be a US citizen or a permanent legal resident for the past 5 years. Right, one of these things. And what does this cover? The Medicare. It covers some disabled people under age of 65. Assume if the person is not above 65, then we need to see, okay, if is this person disabled, so people will receive social security disability insurance. No, usually they become eligible for Medicare after 2 years waiting period. People who receive this SST insurance usually become eligible for Medicare after 2 years waiting period. So although those with end stage renal diseases, as I told earlier, permanent kidney failure and things, right? They can be eligible immediately. These set of people can be eligible for this immediately, and there is no cooling period or something as such, right? Where they have to wait for 2 years and all. That's not there. Okay. So this is a list of people who qualifies for Medicare. Any questions here?
No questions, but I want to add something.
Yeah, please, please.
So for the Social Security disability insurance,
Mhm,
so even though if the patient is not 65, if they are younger, like maybe around 55 or
mhm,
something, when they apply for the Social Security disability,
mhm,
um, sometimes they wouldn't even the Social Security Administration, like even
mhm.
sometimes they wouldn't approve because
Oh.
because when the patient, if they don't have the proper medical reports, because they
Mhm.
need at least for the past 6 7 years of medical reports. If the
Okay.
patient doesn't have the certain valid information about the reports, then they would decline. No matter how many times you apply, they're still gonna decline it. So you
Oh.
have to, yeah. So either you can apply first time, second time, or third time. It doesn't matter.
Mhm,
If the reports are not valid, or if you
mhm,
don't have so when you go to the doctor first time, okay, the doctor say, okay, so you have this issue, and
mhm.
the reports, you have to keep copies of each and every doctor where you have been to for the past 6 7 years.
Yes, yes, right. Yeah, okay, agree on that.
Yeah.
Sure. Okay, great. Here. Thank you. Thanks for writing. Okay. You can still see my screen, right?
Yes, yes, I can see.
Okay, cool. So now, what are the key takeaways here? So, this Medicare, it's as you know, it's a national program which subsidizes healthcare services for anybody over 65, and it's younger people with, specific eligibility criteria and people with certain diseases, right? That is one. And Medicare itself is divided into four categories: ABC, or be it Medicare Advantage. These are four categories where it is being divided into ABCD for prescriptions. Okay, so and Medicare A premiums are free for those who made Medicare contributions for 10 or more years through their payroll taxes. So through their payroll taxes, they have contributed for 10 or more years. That's when they become eligible for this Medicare, Part A premiums for free. Otherwise, the patients who are responsible to pay premiums for other parts of the Medicare program. So patients have to pay for other three things. That is Part B, C, D. So for those things, they have to pay. Okay. Anything you want to add here?
Um, no.
And yeah, and then what isn't covered by Medicare then? So the biggest potential expense that's not covered is long-term care, right? That is the custodial care. Right? So this is not covered, obviously, right? So this is not covered, and other common expenses that Medicare doesn't include are like hearing aids or exams for fitting these hearing aids, eye examinations, eyeglasses, dentures, right? Most
Mm-hmm.
medical
Yeah.
care overseas, cosmetic surgeries,
Mm-hmm.
acupuncture, massage therapy. So
Yeah.
all these things are not covered by Medicare,
Medicare.
right?
Yes.
So now, yeah, any questions here so far?
No questions.
Okay. Then we'll talk about Medicaid. Now, what is Medicaid? So Medicaid is a state and federal program which provides you know which provides health coverage if you have a very low income. If you have very low income, then there's this particular Medicaid, helps us. How? It offers benefits including nursing home care, personal care service. This is how it helps, and it serves very low income people. There is irrespective of their age, it serves low income people of every age, and persons usually pay no part of cost for covered medical expenses. Now, nothing is going out of patient's pocket usually for all the covered medical expenses. However, there will be a small co-payment that sometimes has to be done. Okay, the small co-payment has to be done. Now, Medicaid is a federal state program. It varies from state to state. It is run by state and local governments within federal guidelines. Meaning, if it is a one in one state, if it works in a different way, maybe it works in a different way in different manner. That's because these are mostly federal state programs, and there might be changes across states. They can define their own things. Okay, makes sense. Any questions here?
No questions.
Okay. Now let's try to understand the difference between Medicare and Medicaid. So although two different programs, but Medicaid and Medicare can help you pay for healthcare expenses. Right? So Medicare, what is Medicare? It's a social insurance program which is funded at the federal level. Definitely, right? This is funded at the federal level. No? So, however, Medicaid is a program that is not this particular program is not solely funded at the federal level. It provides up to half of the funding for Medicaid. That's the difference here in terms of funding. State also contributes here. They provide half of the funding for Medicaid. Okay, and then we have the eligibility, where Medicare is health insurance program for people above 65 or older, people under age 65 and certain disabilities, this we discussed, and all those diseases like ESRD and ALS. Whereas the main eligibility criteria of Medicaid is limited income and financial resources. So this Medicaid and Medicare are two different things that
Mm-hmm.
catering to two different classes of people. Right? Any
Yes.
questions here?
No questions.
Okay, sure. Next is what is health insurance? So health insurance in general or basic definition, it's an insurance against the risk of incurring medical expenses. So you might see a risk of huge expense coming up in terms of medical medical, then you may have to go for health insurance. By estimating the overall risk of healthcare expenses, an insurer can develop a routine financial structures like a monthly premium or a payroll tax to ensure that money is available to pay for the healthcare benefits specified in the insurance agreement itself. whatever is mentioned as part of insurance agreement, we can ensure that money is available to pay for the healthcare benefits. And the benefit is administered by a central organizations like government agency, private business, or not for profit entity. These are few things. Uh, you know, uh, it can be administered by. Okay. Now, but what is the need for health insurance? So the need for health insurance is you can plan and control the cost of medical care and treatment. That's the main advantage, right? So and proper and timely medical care in case of emergencies, and also stay healthy by regular and routine checkups. These are the few you know advantages or needs of health insurance that I would say. Okay. Any questions so far?
No questions.
Okay. Okay. And then what do you need to know? And what we need to know is we need to understand various types of private health insurance that are available, right? We need to understand that. We need to understand the difference between health insurance plans like what are HMOs, what are PPOs, what are POs. We'll try to understand those things. And then we'll become familiar with common health insurance provisions, which include limitations, exclusions, and riders. Okay, we will make sure we get familiar with all these common insurance provisions, including limitations, what are the exclusions that are there, and what are the riders that are there. Or what do you mean by riders? What are the riders? Okay, so any questions?
No.
So okay, so maybe we'll stop here for today. So in terms of
Okay.
components, we'll try to understand each of these things, like what is premium, deductible, co-payment, co-insurance, exclusions, coverage limits, lot of definitions. We'll try to
Okay.
understand all these things in detail tomorrow. Is it okay?
Okay. Okay.
Tomorrow same time we will catch up.
Okay.
Okay, fine. Yeah,
Uh,
okay. Yeah, thanks.
thank you.
Thanks. Yeah, bye.